I think what we know a lot about multigene assays is from its prognostic ability and predictive ability in hormone-sensitive breast cancer relative to chemotherapy use. So it's really been great at allowing many women with negative hormone-sensitive breast cancer to identify a low risk that have a prognostic group, but also predicts that they don't get the chemotherapy benefit. So that group of women have been able to avoid chemotherapy. We often hypothesize, and we all wonder whether that could be true also of the radiation after lumpectomy, for instance. That same group of people who've been able to avoid chemotherapy, if they're dedicated to their anti-endocrine therapy for at least 5 years, as indicated, or maybe longer in some cases, do those women really need the radiation? So far, what we know about prognostic role of multigene assay after lumpectomy is really in the setting of lumpectomy and radiation, where you can see there have been multigene assays tested, and they do stratify patients by prognostic risk into low, intermediate, and high. So that's very encouraging. What we don't know, though, is will that hold without radiation, and could we use it to predict whether that woman gets a radiation benefit? It's also a question for women who are hormone sensitive with positive nodes. Could we use a multigene assay again? If patients had a multigene assay, for instance, for chemotherapy decision making, could we use that as an eligibility to say, well, you didn't need the chemo, you really don't need your post-mastectomy radiotherapy if you have positive nodes? So I think those are fascinating opportunities for studying, and there's ongoing clinical trials.